Okay, and we should start recording now. Again, good morning, everyone, and welcome into my virtual classroom. This is Public Health Science 405, Policy, Advocacy, and Public Health. So this is the course that I redesigned for the undergraduate public health science program here at the University of Maryland. And also there are some students that are also in my public health capstone course. Both courses are for upperclassmen, mainly seniors. There's a few juniors who were brave enough to take my class, but all of them are pretty much pre-clinician. And so I say that because they're not just pre-med. Many of them have applied and gotten into nursing programs. One of them in my alma mater, I don't see her yet here today. So I was really, really proud of that. I got to write her recommendation letter for that. We've had physical therapists join our discussions. We've had physicians. I think today we have our first PA, Ramona Toussaint, and I think we have our first nurse practitioner, Karen Beauvais. And I believe on Friday, we will wrap up with various clinician scientists. So those who also have doctorates, as well as their RN or MDs, different respective health professions. And so just again, thank you for being here during the Public Health Guest Lecture Series. The talks have been amazing, and I hope to have you all back in the fall. They'll be higher advertised, the Associate Dean for Academic Affairs, as well as my immediate supervisor, the advisor and director for the Public Health Science Program. I'm very excited about this initiative. And so we hope to have you all back in the fall because it's amazing and the students have been wonderful. And these are student-led discussions. I know I told them at this point in the semester, they'd be tired of hearing my voice. And as I've said before, I'm tired of hearing my voice. And as I've said before, my story is only one story. There's so many other journeys and pathways to ways people get involved in public health and policy advocacy. So I'm just excited to have y'all here today. And after I briefly introduce y'all, I will turn over the discussion to y'all and the students. My screen. Okay, and today I think this is the fourth round of guests in our public health guest lecture series today, Tuesday, April 27th, and I hope y'all will come back in the fall. The topic today is military in medicine. And today we have two wonderful guest speakers here. I'm so thrilled to introduce them to y'all. And they reached out immediately after I asked, is anyone available? Will anybody do this? And I think they're the most excellent people for this topic. And again, I'm just gonna keep saying it so they'll catch the hint that I hope to have them back in the fall. As many iterations as I'm invited to teach this redesign of the course. And so Karen Beauvais, oh, there's other people coming in. Okay. Keep letting me know if your guests are coming in. If y'all see them, just let me know and I'll let them into the room. Karen Beauvais is a family nurse practitioner, board certified. She's a Navajo with a nurse extern licensed practical nurse, registered nurse, and advanced practice nurse background with over 28 years, y'all, of federal enlisted active Navy Nurse Corps Office Reserve, and U.S. Public Health Service Commission Corps experience. She is currently serving as an independent family nurse practitioner at Phoenix Indian Medical Center, Centers of Excellence for the past 4 years, where she is conquering chronic hepatitis C, preventing HIV infection with its PrEP program, and controlling HIV with antivirals. She resides in, I think it's Laveen, Arizona, with her husband Marvin and their daughter Kayla. Please welcome Karen, everyone. Please let me know if that's your preferred name for the discussion. And I just love, love, love all of the pictures and videos and resources that our guest speakers shared today. So please definitely enjoy them. I'll let them share, of course, what they mean later as I keep them up on the screen for them. If y'all want to share, Ramona and Karen, you want to talk about what you're doing in the different photos and experiences, because you both share photos from your decades of experience, and I think it's phenomenal. I'm in awe just of all the work that y'all have done and are doing in policy advocacy and the health professions and just everything that you're doing it's just very incredible work. It's unfathomable to my non-military brain. And so I'm just so excited that y'all are here. And I hope y'all will talk about the pictures and videos that you shared with the students in the audience today. Ramona Toussaint was born and raised in the South Bronx to West Indian immigrant parents from the islands of Dominica, the Commonwealth, and Martinique. She attended the historically Black College and University, HBCU, Morgan State University with a Bachelor of Science degree in biology, and received a Bachelor of Science in Physician Assistant Studies at the New York Institute of Technology, Old Westbury. She served 4 years active duty in the United States Army as a battalion physician assistant and 3.5 years in the Army National Guard, also as a physician assistant. She served 2 combat deployment tours to Iraq during her service. After her transition out of the military, she has practiced in the specialties of general medicine, hematology and oncology, pain management, occupational medicine, urgent care, and family medicine. Y'all, please welcome Ramona. Please let me know the preferred name that you like to go by during our discussion.
Ramona's fine.
And these are the photos and videos that she shared, which I hope, like I said, her and Karen will go into explain the different things that they're doing in the photos and videos. You know, I know a picture can tell 1,000 words, but I'd love to hear y'all's 1,000 words after I be quiet shortly. And so here's our question and answer portion. I will go back towards the end, but basically pretty much however the students or y'all want to do this after the Q&A. There's a number of resources posted here. Students, I will post it to the sites for both courses, capstone and policy advocacy and public health courses in document format and within the slides. So you'll have it. They've shared a wealth of resources. So I do hope you will read the books, visit the websites, click the links, watch the YouTube videos. So they're all very passionate and focused on HIV and STDs and Native American and Alaskan Native populations, and also a lot of military and veterans resources, especially how you can engage in policy advocacy efforts. So please check those out later on, but I will share them towards the end. So Karen, Ramona, I don't know if y'all want to jump in and talk about the experiences from the pictures that you shared. I'm sure they have a lot of meaning to y'all, or if you want to address some of the student questions first, just let me know how y'all want to do this.
We can go to the pictures real quick.
Okay.
Just to break the ice.
Sure. Karen, so let's start with you.
Sure. The first picture is partial, part of our team here at PIMC, and the U equals U is basically those who are undetectable will not transmit HIV to any other people. So it's a message that we were trying to share with the community to break down stigma with the HIV diagnosis with our patients, because we had some patients that didn't know if they were undetectable that they would not transmit to HIV to other people, and so that was huge. So in the picture is Admiral Wiyaki, who used to be the former IHS director, Indian Health Service director. And then the back was my former supervisor, who's amazing. And then on the right, towards the back, is Eric Hagan, who was the former deputy Health and Human Resource Help HHS director as well. So that's just a team photo. And then the next photo is me when I was enlisted. I think I had just graduated from, I went to an electronics technical school in Pensacola, Florida, and that was my graduation picture. And then this photo here was part of a Christmas photo. They wanted us to show ourselves wearing our masks, and we send photos to our patients every year, and so they look forward to that. And then the last photo is with the former Surgeon General, Admiral Jerome Adams. So just some fun pictures.
Wow, I didn't even recognize him for a minute. I was like, wait, that is
right.
him.
That's a great picture.
Awesome, awesome. Thank you for sharing. And Ramona.
So the first picture on the left is my first deployment in Iraq. I was in, it was a smaller camp. It was called Camp Falcon. And this was in 2006. And I was sitting in my troop medical clinic in the trauma room. So that's what our trauma rooms kind of look like. Everything's just organized in shelves and, you know, as best as we could in a tactical environment. The second picture, I was promoted, obviously. This was during my second tour to Iraq. I was at Cobb Adder in Talil, and I participated in the Smile Train program. So the Smile Train was a group of dentists who came all the way from Italy to work on fixing cleft palates for Iraqi children. It was so unique and an amazing experience. I got to be, that was actually the OR. And I got to stand right next to these renowned surgeons and witness great things. The third picture is back to my first tour. That's in front of one of the medevacs, we call them, helicopters, where they would use these to transport patients. And as you can see, I'm old. No, I'm just joking. You don't see any of the new uniform. This is all the old BDU uniform. And the last picture on the far right was, I believe, during my first deployment. I was removing a lipoma from the back of a soldier's neck. So I did a lot of minor procedures, hands-on procedures, a lot of things I did overseas. I most likely might not have had the chance to do in the States as a new PA, as a brand new PA. So yeah.
Thank you both so much for sharing. Wow, just amazing experiences. Incredible work, incredible work. One of the top questions that we have been getting, and again, students, enter the chat box if you want to get your questions in, if you didn't get a chance to get them in. Remember, this is your discussion. So if anybody has any burning questions, I actually will, let me check. Oh, I do see questions. Oh, great. All right, Brendan, take it away. I'm going to be quiet now.
Okay. First of all, good morning to everybody, and good morning to you, Miss Toussaint, Miss Beauvais. I'm sorry if I'm pronouncing that wrong. But my question for you was, since you both have served such like extended careers in the armed forces, like how has that provided you like a unique experience, like with medicine and with, you know, the world of public health? You know, because the people that we've heard from, you know, I wasn't too sure they weren't, you know, kind of in the Army and the armed forces. So, you know, you guys actually being, you know, really in what I consider kind of the thick of it, and saying how that has molded your experience.
I'll go ahead. So when I was deployed, public health was a very, very important big issue in Iraq. So I definitely participated in education. I participated in teaching Iraqi soldiers, which was pretty cool. Hygiene, dental. I've ran lectures in Iraq to Iraqi women. We actually created a breast health conference. So education is in terms of public health is very important, even when we're deployed, as well as in garrison as well. So remind me if I say some acronyms that y'all might need me to explain. So when I say garrison, that's in the stateside, like on base. I was stationed at Fort Hood. I live here in Killeen, Texas. And if I say downrange, that's when I was deployed to Iraq.
For me, being in the Navy, I was doing mainly technical work. I did do a couple of years in the reserves, but that was I went to, where did I go? I went to Washington State, did 2 weeks there at Birmingham, and then I did 2 weeks in San Diego. So not a whole lot of public health, just working in the hospital. But working for the USPHS, we can work at several sites throughout the country. We can work for the BOP, we can work for USDA, FDA, and I just happened to work for the Indian Health Service. And Indian Health Service, working there, everything there is public health. From just daily encounters with the patients, counseling them on being active, being healthy, and then with our clinics, HIV clinics, we're trying to control their HIV. So it's encouraging them to take their antivirals on a regular basis, being controlled so they don't transmit to other people. PrEP is another clinic that we run, and that's all about education. And the more that our patients are seen in our clinics, we get better control. So far, we've had about 90 patients in our PrEP program, which we've increased fourfold in the past 4 years. So that's great. But we've had no active HIV patients while they've been in the program. So it's all about teaching, and being on the medication. In our Hep C clinic, same thing. It's all about teaching, taking the medication every day, healthy living, no smoking, no drinking, minimize all of that. And then when it comes to, I also do, I'm starting to do oncology as well. And that's all about teaching too, anticipating what treatments are coming along. So every day is public health, along with doing health fairs, along with doing, participating in statewide conferences. It's daily public health.
Thank you both so much.
Ray, I think you had a question for Ramona.
So I do have a question for Ramona, but before I start, I want to thank both of you for serving our country and keeping us safe. Thank you both for your courage. And actually, my question, okay, I'll just jump into it. So for Ramona, but it's also for, I guess, Karen as well. I'm curious regarding how you got your start into your careers. Like, I know nursing is, a profession that's been around for forever, but with the PA, it's a little newer. It's been around since the 60s. And I looked into it. I guess with me, I'm more leaning towards MD, but I was interested in PA because I like the scope of care. I like the flexibility regarding it. And then not to mention like the liability with PA. In regards to the scope of care, the things you could do, but also the liability. You don't have to, the responsibility isn't, I don't know. I'll just cut that there. But with PA, I guess what kind of turned me off is it's not the jobs, they aren't everywhere if you want to go abroad. So like I was looking at living in France, and in France, it's not something that translates. Maybe not yet, or when I was looking a year ago, but it is a job that is in Canada and some of the other countries, even some developing countries like Ghana. So I guess I'm more curious how both of you did the different trajectories. And I did also look at public health. So the military has the public health, which I was interested in because they can stay in like one place for like 10 years versus with Ramona, the Army like bounces around. And, for me, I was like, ooh, probably not for me because you always are moving around. But I also like some of the incentives with the military, for instance, like they'll pay for your med school. So in Maryland, they have USIS, which is a med school where they will pay full ride as long as you get accepted into it. So I'm curious how both of you went your separate ways into medicine. Thank you.
Okay, so believe it or not, when I was a child and growing up in high school, I wanted to be I wanted to be a civil rights lawyer. I know, completely different, right? And I was always really good in science, right? So I just always excelled in science. My mother was a registered nurse at Calvary Hospital in the Bronx, and I started volunteering when I was in high school there. My grandfather was terminally ill with cancer, and I just started gravitating more towards the yearn to care for those in need, those that were sick. In college, same thing. I actually was an undeclared major freshman year, and then sophomore year, I said, you know what? I keep doing so well in science, and I keep loving biology and learning about the body and stuff like that. So I declared it, joined ROTC. My father was a veteran. He was in the Vietnam War era. And I also wanted to help pay for college. So I had a partial scholarship at Morgan State. And so I got commissions. So to backtrack a little bit, my first choice actually was to go to medical school. But my aunt Lillian actually mentioned to me, have you ever thought about PA? And I'm like, what is that? So I looked into it and I was like, this is pretty cool. Like I can go to school for the less amount of years and do almost the same thing. So I applied, and I actually was commissioned Air Defense Artillery. So I was going to be sent to Fort Bliss, Texas, to be a medical platoon leader. But I stuck to it. I didn't give up. I applied, and I asked for special permission to go to a civilian PA school, NYT, in Old Westbury, New York. And I was approved. I was one of those rare cases where they gave me an educational delay. And I went to PA school in New York. The transitioning wasn't that hard with my degree, so that was good. I only had to take one semester of a few courses that I didn't take as a bio major. And then I went right into the program and graduated in 2005. So that's what got me started into the PA profession. In terms of what a PA does, so I loved the autonomy. Yes, we are under a physician's license. The military is a little different though. We have complete autonomy. We have a brigade surgeon who is a physician who oversees all the brigade PAs, all the different battalion PAs within a brigade. And we would consult him on any issues that we needed to, but pretty much we hit the ground running. As soon as I graduated PA school in 2005, I went to my officer basic course at Fort Sam Houston in Texas, in San Antonio for 3 months. And then I showed up to my unit at Fort Hood. At the time it was 4th Infantry Division, 4th Brigade. They sent me straight to Iraq. I was like, I have no experience. I have no trauma experience. And it was wild. It was wild. I actually convoyed in, and they told me that I was in charge because I was the officer. And I'm like, are you serious? I mean, we was in a little Humvee late at night convoying to the camp that I was going to be at. And I'm here, a brand new young 25-year-old PA, second lieutenant, butter bar, the lowest of the low for officers, and just scared. So yeah. That's my part. I hope I answered your question.
Just one more question. So yeah, I guess the second part. So have you ever looked at maybe going abroad? I know you're,
Oh yes,
all
you
about
did.
being in the United States, but yeah, no. Okay, so I also did. So I talked to a Navy PA, and he was saying the same thing, basically, that PAs have a lot of autonomy, and even just working. So for instance, for him, he worked a little bit in neurology, and he was saying that just having some experience there, he was able to just do neurology, and if he wanted to float somewhere else, whereas doctors often are more locked into whatever their profession is, PAs do have more flexibility. So I was like, wow, that's actually really interesting to me. I mean, I'm sure you have to do some training, but that was one of the aspects I like, because you don't want to get locked into one thing,
Mhm.
So
That definitely influenced my decision as well, because you could float around to many different specialties. You saw in my bio, I did quite a few different specialties. And in terms of abroad, there are a lot of opportunities for PAs abroad. There's PAs Without Borders. I don't know if any of you knew that. So just like Doctors Without Borders, there's PAs Without Borders. So you can do a lot of humanitarian work that way. And you can also do contracting positions as PAs. So when I transitioned out of military service into civilian service, I was getting offers to actually work as a PA overseas as a contracted. So a lot of those positions would be, for example, to medically assess all of the guards that are working at a specific location, let's say Kuwait, or managing a clinic overseas. So they are out there.
thank you, Ramona.
You're welcome.
Karen, how did you get into the Navy and
Yeah.
now commander in the United States Public Health Service?
A long story, but when I was about 12, my grandfather had lung cancer. And so I think that was a big influence, watching him basically wither away in front of our eyes. And he didn't want to be hospitalized. He wanted to be at home. So he was actually on the Navajo reservation in the middle of nowhere. And we gave him hospice care at home. And so in my mind, I'm only 12 years old. I'm like, what else can we do? What are we not doing? What can we do? And so that kind of planted that seed when I was young. And as far as the U.S. Public Health Service, it's been in my life. I was actually born at the hospital that I work at right now, and have been exposed. I've seen different officers as I was growing up, had been seen and received care. And so I was like, that'd be kind of cool to do someday, And so when I went to the Navy, I did something completely different. I did electronics. I did that for 6 years. But when I got out, I went back to school to become a nurse, with the goal of coming to the public health service. So it was a step-by-step process. And like I said, I started off as a student nurse, and then as an LPN, and then as an RN. And then I worked as a registered nurse for 10 years before I felt like I was ready for the next step to even try to become an NP. So it was a long process for me. But it's been fun.
And to Ray's
Yes,
question,
Mhm.
sorry, was someone asking? Ray, was that you?
No,
No.
that's Dr. Samuel. I had a question also.
Oh, go ahead, Dr. Samuel.
Yes. The question is kind of broad-based, since I teach, biology, and I have a lot of students who are interested in the medical profession. Most students want to go to medical school. Very few students mention physician assistants as a potential career choice. I was wondering the route that you addressing it to both of the speakers there, the route that you took to where you are now in terms of becoming a physician assistant or a nurse, for example, in the military. One, would you advise students to, to try this approach to, achieve their goal of becoming physicians assistants or nurses or MDs? And two, there are very few physician assistant schools as far as I'm aware of, and it's very, very, very tough, very competitive to get into those schools. And once you get into, let's say, the military, do you have much of a choice of, what you want to do, or you have to do what the military wants you to do, so to speak?
Okay, I'll go first, Dr. Sam. If y'all don't know, Dr. Sam is one of my mentors from Oregon State. Little shout out there real quick. I worked for him. We did research in the lab. Ironically, also on an HIV gene, Kathy's, Karen. So that was, when I saw that you were doing that, I thought that was pretty cool. While working with HIV. And so I tried the military. I did not go through, so the way I became a PA, like I had explained earlier, was a little different. I wrote a letter and submitted to be approved to go to a civilian program. So for me, it was completely different. I went, completed the PA program with the mission that when I graduated, I would take my board exam. Once upon passing my board exam and becoming certified, I would go into the training for the Army Medical Specialist Corps. In the Army Medical Specialist Corps, that is a corps that consists of occupational therapists, physical therapists, dietitians, and physician assistants. They work on, so basically our goal in the military is to keep the soldier healthy, promote health, make sure they're performing optimally, ensuring their rehabilitation, controlling any injuries, and also education. There is the Army Inter-Service Physician Assistant Program. I have a lot of peers that went to that program, and that is another option to become a PA in the military. But when you become a PA in the military, that's your job. So my choice was to practice medicine. So I was happy about that because, like I had mentioned, my initial assignment was to be a medical platoon leader for the Air Defense Artillery Corps. So that's the benefit of being a clinician in the military. That's what you do. You don't sway at all. So I was a physician assistant my entire career, during my entire military career.
So to all the students out there, I'd say yes, you are needed in this healthcare system. If whether you're a doctor, a nurse practitioner, a PA, physical therapist, pharmacist, especially I feel that providers are needed to serve people of color. I think it's sorely needed for the Hispanic community, for the African American, for the Native American. We're just sorely needed right now to provide culture sensitive care. That's one of the things that the patients really like about our facility is that, they see someone like them and we have that connection right away. And so you establish trust right away. And that just goes a long ways for taking care of them in the long run. As far as specialties, I had to move away. I worked at this clinic as a HIV case manager for 6 years, and then finished my NP program. And then I had to move to another location because they didn't accept new grad NPs. So I went to a Hopi Indian reservation and worked there for 3 years. And that was the best experience I ever had, because the variety of clinics I got to work in. So I got to work in urgent care, ER. I worked in pediatrics, women's health, just a lot of, and the women's health was actually pretty cool too, because it was so remote. We had a mobile van that came over from Phoenix to Hopi Healthcare Center, which was about 4 or 5 hours away. Once a month, they would have a mobile van come over, and they would do their mammograms there. And I would be in a separate building doing their well woman visits. So they'll have the well woman visits, and then they'll get the mammogram on the same day, out in the middle of nowhere. So that was pretty cool. So so that was working remote at a Hopi Healthcare Center, and then I moved back to Phoenix, came back to the clinic where I worked at before, and then just came in as a provider this time. And starting with HIV, but we started a brand new Hep C program. This was in 2014. And so we had like 800 patients that were positive for Hep C and needed treatment. They had been screening people for a number of years, but we didn't have a good treatment tool until the new direct antivirals were coming out. And so we just had one Hep C patient after another, and thankfully we got to the most of, we offered treatment to almost everybody. So it's just something that you just step into when there's a need, you just step into it. So the next need is I'm stepping into oncology, and I saw that Ramona has a history of working in oncology as well, but it just never ends. There's always something else that needs to be addressed.
Thanks very much. I do appreciate it, and thank you all for your dedicated service to us all in this country. I have another meeting coming up at 10:30, so I'll have to, exit right now. So thanks for the invitation, and good luck and all the best to everyone.
Thank you for joining, Dr. Samuel.
Thanks.
Chelsea. See, Chelsea has her hand raised. She has a question.
I asked a question in the chat. So my question was basically just, like, as being women, how was your experience in the military?
So my experience was definitely a challenge. So I always said I had 3 things against me. Me being short, me being a minority, a Black female, and being a woman. So it was tough. It was tough because in the beginning, I didn't really know what was going on. I was timid. And if you're a timid female in the military, they will definitely challenge you. So over the years, I definitely learned to be more assertive. So the military taught me a lot of assertiveness, and you basically have to speak your mind, of course, according to, the guidelines with respect to rank and everything. I did have my moments, but because I'm very passionate when I want to advocate for my patients and my soldiers. So, yeah.
I'd say the same thing. I'm short too, minority, and I'm a woman, and it is true. It's a little bit harder. When I first went into the Navy, enlisted, again, I was in a different line of work. I worked as they call it a cryptologic technical maintenance, but basically you're doing electronics, and it was all men, and it was really hard. But over time, if you just keep doing your job and doing the best that you can, just earn that respect. It takes time, and just keep on top of what your job is. Just do the best to your ability, and you'll be fine no matter what you do.
Thank you for that.
You both have kind of touched on policy advocacy, which is why we're here. I'm a policy expert, and throughout my course, I've been highlighting how they can engage as future clinicians in policy advocacy for public health issues. And so I know, Karen, you've mentioned a lot of your work in HIV and STDs, and Ramona, you've mentioned some military health issues. Can y'all share more, elaborate on different issues that you're passionate about for policy advocacy work?
So I am a strong advocate for mental health and military veteran health. And I counsel veterans who need help with their medical conditions, their medical claims, so that they can get the right treatment and compensation. And yeah.
For me, it's just being able to provide the best care, up-to-date, guideline-based treatment for all areas, for HIV, for Hep C, for PrEP. Because the meds are fairly new, and I work for the Indian Health Service, and usually we're like last. We get the medications last, and if there's a newer medicine, we usually have to wait years to obtain that medication. When we first started Hep C, treating one person for Hep C could be as much as over $100,000 at the time. But things have changed, policy has changed, and the Indian Health Service now can get the same drug rate as the VA, so that was a game changer. So now we can provide Biktarvy, which is first-line treatment for HIV. We can treat with Mavorite and Epclusa, which are first-line treatments for Hep C. Whereas, and I think a big part of it also was because of our group here. My former supervisor, Dr. Bloomquist, got on the National Therapeutics, Pharmacy and Therapeutics Committee, and that was, I think, he was able to, because of his experience in these different areas, was able to promote these medicines to be on the national formulary. So that means that all IHS facilities across the country have to have that medication on board. So then therefore, the same medications offered for all of our patients. So that's near and dear to my heart.
Thank you both for sharing. Something I tell students a lot is that advocacy is beyond changing simply policies at the local, state, or even the federal level, but a lot of times advocacy is essentially education. And so it sounds like you both do a lot of educating, whether it's patients or people around you. I know Ramona talked about mental health, and Karen, you're talking a lot about different public health issues, especially what's considered behavioral, and sometimes it can be taboo to discuss those things with patients or people in the community. So can y'all talk a little bit more about your experience and how specifically you got involved in those specific issues? I know for Karen, you mentioned Hep C and HIV, and some of your work with a lot of the drug interventions being newer, but how specifically did you, I guess, choose that area? Because you mentioned technology and then going back to school for nursing and kind of getting into that. Why specifically those diseases? And then Ramona, for you, specifically, why mental health?
So for me, mental health really hits home because I am a PTSD survivor. And I say survivor because I'm blessed to be here with all of you speaking today. I having been gone through 2 combat deployments to Iraq and actively working as a physician assistant in a war zones, pretty much. That I did not know that it affected me because I worried all the time on focusing on the health of my soldiers. I could care less about me, and as in school they teach us before we graduate and go on to practice as clinicians, be careful for burnout, be careful for burnout. Well, burnout got me. And in 2012 to 2013, I started having symptoms and I was not aware of them at work. I started having paranoia, hallucinations, and it pretty much spiraled downward very quickly, where I had to be hospitalized inpatient twice. And then I was diagnosed with PTSD, acute PTSD. And I went through a recovery period of outpatient and inpatient therapy for roughly 6 to 7 years. So it really hits home. A lot of veterans suffer with PTSD, depression, suicide, homelessness. A big factor of a lot of the big rising numbers of homeless veterans in this today is due to mental health. I would say a big factor for soldiers, because at the end of the day, I was a soldier, is pride. A lot of my comrades, including myself, we have pride. We don't want to be seen as weak. And I just was in denial for the longest that I had PTSD. And when I showed up to therapy, group therapy, I was such a workaholic. I told the other vets in the room, I'm gonna be gone in 3 months. What are you talking about? I'm gonna be back to work. I went religiously to group therapy, like I was in college, had my books, my notebooks. I was serious. And they all laughed at me, the older vets. I learned a lot from the older vets. They're like, oh, well, you'll be all right. You're gonna be here for a minute. Just calm down. So this is why it hits home to me. I never thought in a million years that I would be in a mental ward, not even knowing how to say the alphabet. And I have 2 degrees, not knowing how to count. I pretty much reverted to a 5-year-old child. And I thank my family and friends who supported me through that. And I'm so blessed to have recovered from that, and now being a strong advocate, helping other veterans who are in need. I'm also very passionate in sharing my story. So I'm looking to become a peer support counselor, where basically because I have personally been through these mental health challenges as a veteran, I would go forth and counsel veterans who are going through the same thing. So it's like I can relate to them and I can help them in their recovery process.
Thank you for sharing that, Ramona. I think mental health is a huge issue across the board. One thing that I saw at Hopi Healthcare Center was a lot of kids there. There's no access to a mental health provider within like 100 miles. And these kids, a lot of them are victims of abuse, physically, sexually, mentally. And I just felt that they weren't getting the care. And it crossed my mind to go back to school to become a mental health provider, but can only do one thing at a time. So if you're interested in that sort of stuff, there is a heavy need for mental health. So do consider that as a job in the future. As far as how did I land in the position of treating Hep C, it was just, I just happened to be at the right place at the right time. They needed somebody to treat Hep C patients, and they were already overloaded with HIV, and so I came on board and just concentrated on Hep C for about a year or two until we did a bulk of who needed to be treated was treated, and then crossed over and cross-trained in HIV, and then now there's a need for more help in the oncology, so it's just following where the need is. So.
I think you both are in rural areas now, if I'm not mistaken. I'm not familiar with Arizona. I'm not sure where Laveen is. Not even sure where Killeen, Texas is, to be honest, but I think it's rural. And you mentioned previously, Karen, Navajo Nation being remote or rural. I'm not sure where at you were located specifically, but are you currently engaging in any work in rural or more remote areas?
I'm actually located in Phoenix, so I'm urban right now, but my previous assignment was very rural. Yeah. And Levine is just a suburb, I'm sorry.
I was gonna say Killeen is not rural. We do have cows and stuff if you drive down the street sometimes, but we're not that rural.
No.
Hey, John.
How you doing?
I'm good. Everyone, this is a Purple Heart veteran right here.
I just happen to be, I tell everybody I'm a two-time Purple Heart recipient. I am a Vietnam veteran. I was glad to join this, to listen to what y'all have to say, because I'm going through some changes right now too, because I lost my wife the 4th of October, 2019. But I'm dealing with, well, Ramona, you know the class that I'm in. So yes. I'm still in that class, and we still got great support. But right now we're doing Zoom because we're not back into the hospital yet. They're not letting us back in yet. But I'm dealing with situations, and I'm still helping soldiers doing this to it keeps my mind occupied. Mm-hmm. But it helps. But listening to you all is a great help to listen. And I'm glad you invited me to come in on this morning. I'm sorry, I thought it was at 9:30, but I guess I got in late. I don't know how long y'all been on. And I apologize for coming in late.
Oh, you're fine. We're just, because we're an hour behind. So it started at like 8:30 our time, but not right away. So you didn't miss too much.
Okay. But glad to see you, and I'm glad you're doing well and you're doing some blessed things.
Thank you. Everyone, I would like to quickly say regarding Mr. Footman that I was the only female so I'm in a group, one of the groups that I'm in is called Vets Helping Vets. And it was all males and everybody was scared, and all the female vets in our program was like, oh, don't go to that group. They're gonna eat you alive. Okay, well, I'm like, I was assigned to an all-male unit for a year. I think I can handle this. So they welcomed me with open arms, and I have learned so much from these guys, these veterans, and they're a wonderful, lovely group and very supportive.
And we miss you.
I miss you too. I'm gonna come back.
Okay. All right. We'll be glad to have you back.
That's awesome. We're glad to have you here, Mr. Footman, and thank you for your service. Vietnam and Purple Heart. Wow, I'm in awe. So definitely thank you so much for being here and being vulnerable and sharing your story. Ramona, thank you so much for sharing your group. And I'm glad y'all have that peer support and that network. I'm sure I can't even fathom or understand how important that is in significance to you, but I did want to take a moment and just honor your service and thank you for being here. While our topic is military and medicine, I'm sure you've still seen things that are still related very much to public health and policy advocacy. So thank you, Mr. Footman. Thank you so much for your service and
Yeah,
for being here.
I can laugh about it now, but I tell everybody when I got wounded, since I made it, the God pulled me through all this. I was told the second time I got wounded that I'd never walk again, but God had another plan for me. And I joke about it sometimes. I tell people I wasn't clipping fast enough to get out of the way of the bullets or the mines. But I thank God that I'm still alive. I'm still here to talk to you all about this, and thank y'all for your service. So, and thank you for having me on this. I appreciate Ramona sending me the text yesterday.
Yes, Karen and Ramona also thank you for your service. If I or the students haven't said that yet, just definitely appreciative of you all. Like I said, I'm in awe. So I just think it's fantastic with the work that y'all have been able to do and your backgrounds. Students, I'm talking a lot. So if you all have any questions that aren't present here on the slide, if you didn't get a chance to submit it, I do see the chat. Is there a question there? Oh, amen. Chelsea, right. Never walk again, but but when God says yes, like, yeah.
That's right. God had another plan for me.
Definitely feel you on that, Chelsea.
Right.
So I guess kind of going off of, I guess, Mr. Footman's energy here is, what do y'all think is like one of the greatest issue? And I know he mentioned being a veteran, Ramona mentioned mental health, and Karen has shared how you've gotten into the workspace that you're in, just kind of being the right place at the right time. And so kind of what is that right place right now? Oh, okay, well, Karen, you can share first since you have to go. What is that issue right now, that biggest challenge that you would say right now for health policy and or public health?
Oh, that's a big question. There's so many needs, there's so many, I just try to focus on what I can handle, what things that I can do in my little world. But eventually, just advocating for your whatever you're passionate about, whether it be certain diseases, whether it be on a state level or national level. We just need to pull together. There's so many needs, so many unmet needs that we need to address. And I wouldn't even know where to start. But for now, I'm just focusing on what's in front of me.
Thank you, and that's honest, and we definitely thank you for your time. I think that's a very salient message for students to prevent burnout. Focus on the opportunity that is right in front of you and the impact that you can make in the role that you're in, and not doing all the things for all the different issues, because public health is big. Thank you, Karen. Thank you so much.
Bye, everybody.
I will be in touch.
Bye, Karen. For me, I would say mental health, of course. I focus a lot on that because it is such an invisible illness. A lot of people will look at myself or other veterans and be, oh, she's fine, nothing's wrong. If you only knew. We hide things. Sometimes, you can't see something mentally affecting a veteran. And suicide is another big platform that I support. Having been there myself, I've been suicidal many times in the past, dealing with my PTSD. So for me, I focus on, that's my main focus is mental health and suicide in terms of veteran health. And that's that's the major public health issue for me that I've heard that I work on. So
that's fair. Thank you so much for sharing. I know you've shared a wealth of resources in that regard. Students, any remaining burning questions? I want to be respectful of everyone's time here today, especially Ramona, for being so vulnerable and giving so much of herself to y'all today.
You're welcome. I also want to add in that I'm also a strong advocate for military sexual trauma. I can talk at length of all the different things, but having also been a survivor of military sexual trauma myself, I think that this is a very big, major issue in the military right now. Everybody, I'm sure you've all heard of the death of Vanessa Guillen, actually here at Fort Hood, Texas, April of last year. They actually just renamed the main gate in honor of her name. So when I wasn't active, I directly, like I said, was personally affected by it. And I also had to be in the exam room with the authorities and the nurses and to do the rape kits. And it was a lot. It was a lot. That is another major issue that I'm an advocate for, is MST.
I actually had a question in regards to that. So for Ramona, like, what would you say for a woman? Because I have friends who are in medicine, and when I always ask like if you would consider military, one of their main things is like no because of that reason, and I'm talking about like Black women mainly, and their main reason of not choosing military is because of what you just mentioned. So like, is there any advice you can give to like women who feel that way concerning maybe not going that route just because of certain experiences they may feel like may happen to them as well?
I definitely would not discourage any female from joining the military. It is unfortunate that military sexual trauma occurs, but it's because unfortunately the system has failed in a lot of different locations within the military. But there are programs set in place to help protect women, equal opportunity, sexual trauma. They educate the soldiers. So honestly, it's not a big issue. You just come across, I just came across, unfortunately, the wrong individuals. But it's not like, oh, hey, let me join the Army and boom, you're automatically sexually harassed or, in danger of MST or anything like that. It's a brotherhood. Being in the military, you definitely look out for each other. And you feel once you start serving, and pretty much there's a saying, I got your six. We watch out for everybody. We have each other's backs. So it's unfortunate that there are these situations where soldiers, were hurt or unfortunately, killed. So
I guess I do have a question. Trying to lift it back up. I definitely appreciate your sharing so many of your experiences and then with PTSD and just going abroad. Because I guess one of the other things I thought about the military too, I was like, oh my God, I'm gonna go. They're gonna send me to Afghanistan. I don't want to do it. But that's I think that's one of the things that people don't understand. It's such a rare thing, even especially I guess being a PA or in the medical profession, your rates of going increases, but everybody doesn't go to a war zone. I thought, oh, if I go to the Navy, I'm gonna go to a ship, but no, you don't. Sometimes people are just land-based, or you're not always doing the thing that you think the military is. So I think what people do in the military, the scope is just like insane. But what are some of your standout moments, your favorite moments with your military experiences, or any patients that stood out? You're like, wow, this was somebody I saw through one of the most traumatic points of their life, or I just did intervention and it really left an imprint on me. What is that for you?
So when I was deployed, the key trauma, because I experienced several traumas. My first deployment, we were attacked by mortars and rockets constantly. and had a lot of bad mass casualties and traumas. And the first patient I lost, that definitely to this day, believe it or not, makes me feel like a failure. So I'm a brand spanking new PA and I'm gung ho. But when you're in that situation and you haven't had that much trauma experience, it's fight or flight. You know, I don't know why I beat myself up so much, because I did everything I could in the moment, you know. But that's definitely a trauma that stays with me. The positive memories are doing the medical mission. So my first tour, I never left the base, but we got attacked so much, I was constantly working on traumas. The second tour, I was at a nicer base. And it didn't look like a little outpost. It looked like I was in the States. I was confused. It was an Air Force base. And I'm like, what? I have to go out the wire? Like, are you serious? Like, me, short 5'1", me, like, I have a 9. You don't want me to start shooting. The gunner better know what he's doing. So I went on missions where I assessed Iraqi children and women, and that was really cool, really cool. I saw so many rare medical conditions and deformities, and it really opened up my heart. And I definitely wouldn't trade that experience for anything.
Thank you.
Thank you, Ray, for the awesome question. And thank you for sharing, Ramona. I do see we have a question from Ms. Jones. She has her hand raised.
Hello, my name is Stafson, retired Peter Gay Jones. I'm a battle buddy in front of Ramona. Hey, girl.
Hey.
Ramona invited me to this Zoom, and I caught a tail end when we were talking about MST, PTSD. I myself is a survivor of military sexual trauma. I also have PTSD and depression and anxiety. Ray asked the question as in whether or not the branches I serve in both the Navy and the Army. So I have a different experience on both ends. My Navy deployments were a lot different from my Army deployments, I must say. That I did do the ship, I did do when the tsunami happened in Indonesia. That was definitely an experience. At the time in the Navy, I was an aviation mechanic. In the Army, I was human resources. But we're all soldiers and we're all sailors, so it doesn't really necessarily matter what your job is. If that's where you're needed, that's where you're needed. So in the Navy side, even though I was aviation mechanic, eventually I switched to a culinary specialist. So we did patient feeding, and so I ended up on the USNS Mercy, which is a hospital ship. And I must say my Navy experience was a lot better than the Army. My sexual trauma I experienced in the Army, the great place that we're both at now, Ramona, but I wouldn't trade it. I mean, of course, we deal with these issues every day, but I wouldn't trade the experiences, most of them, because I gained great friends, great battle buddies, lifelong friendships from just serving. So I feel like if that's what you want to do, go for it. And there's nothing set in stone to say that you're going to experience bad things. Some people go through their whole career just fine, and then there's the rest of us who just get the bad end of the stick. But I feel like just do what you want to do and you'll be all right. Just get those good friendships, because not everything in the world, not everybody is is going to be good to you. But when you find those people, just stick with those and they'll get you through everything.
Yep.
I want to add on to what Peter just said. What I love about being in the military is, with everything going on right now with race relations, in the military, it does not matter what color you are. As long as you bleed red, we have each other's back. And I love that. I love that. And I mean, of course, we wish the world would be like that, right?
Yeah.
But that is the most amazing thing I love about the military. All race, color, creed, we will take a bullet for each other.
Thank you so much, especially Ramona, and for inviting your fellow veteran comrades on here to share their perspectives and support you also. It definitely, you know me, I'm beyond the one story narrative. I love, love, love hearing different people's stories and experiences, and giving student these experiences also, and hearing your voices to make the best decision for them. So thank you, Pizza, for sharing. Do what you want to do, and make your decision, and for them to understand that it's okay that bad things may happen or we may come across bad people. But thank y'all for sharing the positives and the good memories that you have for your experiences, and encouraging them to do the same, and definitely leaving us on a note of hope. Any final remarks, Ramona, anything that you would like to leave them through? Would you like to mention some of the resources that you shared? Should they, if you wanted to highlight a few of them, since it is a very robust list of resources and various types, which I so appreciate, very thorough. Definitely the most of any guest we've had so far in the public health guest lecture series. And so I really hope they are encouraged to pursue military and medicine in their own way. So would you like to share some of the resources and mention maybe your favorites? Okay, I can go through this as well. Okay. Those were the ones from Karen for the Indian Health Services and Native American Health. You mentioned some grounding techniques. I know you mentioned mental health and PTSD and also MST. I don't know if you wanted to talk about what this was that you shared.
So grounding techniques, because I'm such an advocate against burnout, this is just some suggestions I put out there. Even if you're still in school, you can use this. Because the key thing is to allow yourself time to rest. Don't overwork yourself. And yeah, that's the best I can say about this. But basically coping mechanisms that have really helped for me. For me, my most important coping mechanism is music. And I didn't talk about this, but I'll briefly touch on this. When I had my, we call it a breakdown, right? My PTSD situation where I was inpatient, blah, 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 had to learn pretty much everything again, so to speak. Being from the Caribbean, I always was into, of course, my parents' music, soca and stuff like that, but A1 soca. So
I'm glad someone else said soca, because when you said music, my mind was like, she means soca music, y'all. She doesn't mean
I'm like, how much should I tell them about soca? I'm like, I don't know. That's why I paused.
I was about to put in the chat. I'm glad someone else
say this the right way.
Right, fact. Soca music. Maybe bouillon, maybe zouk, but soca music is what she means.
No, so in 2014, brand spanking new, out of inpatient and into recovery, I decided to start participating in carnivals in the States. Particularly, I started in Houston. Of course, I went to carnival as a child in Dominica and in New York Labor Day weekend, but that created such a spark. Being around Caribbean people from my heritage, I feel safe, I feel at home. I feel okay in that setting, large group setting for some reason. Yeah, it gives powers. It definitely does. Soca gives powers. So I decided to become an entrepreneur. And with the help of the Texas Veterans Commission, they helped me start an LLC, and I started my own business called Proper Things. And through that platform, I can express my passion for my culture through events, sponsoring carnival events, promotions, accessories, and clothing. So, yeah.
Wow, that's amazing. I was just saying clinician, veteran, business owner, entrepreneur, what is it? Soca enthusiast, carnival, carnival queen, just everything. I mean, just everything. Wow. I'm really in awe at all that you have brought to the table today and to the discussion. I mean, you've set the bar really high for the public health guest lecture series, certainly. So I'm just in awe. I do think you did share beyond the grounding technique. Thank you, Ray, for being vulnerable and sharing that he uses these. So I don't think I've ever seen this list before. I've seen something like the 5 senses, and so
yeah, there's different ones, Professor. Yeah, I didn't use
oh.
this. There are other grounding. But in this she lists different ways, different ways of grounding. Like these are different things. Like reading, like these are all different. These are like 16 different ways to ground yourself.
Okay. Yeah, I've only ever heard of the 5 senses, but I'm gonna save this list in my back pocket so I can, hang on to this for a rainy day. Maybe we do some of these things without realizing it to cope and stuff. So this is a really excellent list. So thank you definitely for sharing this. I think
Welcome.
Oh, go ahead.
Sorry. I definitely do the 5 senses all the time, because when I was ill, acutely ill, my senses were all over the place. My hallucinations were in all the 5 senses. Seeing, smelling, hearing, tasting, touching, everything was not real, and I thought it was. So I always ground. If I hear when they do training at Fort Hood, because you can hear it and it sounds like you're in a war zone sometimes, I have to remind myself. And if the dogs bark, I'm like, okay, I'm good.
That's good. That's good.
Yeah.
You mentioned several books. So I was saying from this, is there any specific 1 or 2 that you mentioned to the students that were really informative for you? I know a lot of these are relating to PAs, but there's also several veterans books.
Yes. Thank You for Your Service is a very great book that really talks about PTSD affecting veterans returning back, affecting soldiers returning back from downrange. American Sniper, I love that as well. I love the movie, very popular movie. Again, showing how PTSD affected a soldier upon his return back to the States. So those 2 are the best. I also love Get Out of Your Own Way, number 18. That book actually went through in a group. And that book is amazing. It teaches you pretty much how to just keep it simple, KISS, and you got this. you got this. So it's a very uplifting, motivating book. I love that book.
Okay, so Thank You for Your Service, American Sniper, and Get Out of Your Own Way. Okay, is American Sniper, is that the one with Bradley Cooper? Never seen it. Is that
who played him? Yes.
Oh, okay. All right. I might get on that soon. I don't think I've read any of these books. So I'm guilty. I will do what I'm encouraging my students to do, and I will pick one of those up. I did read War by Sebastian Younger. He came to GW when I was getting my MPH there, and spoke a lot about losing a fellow journalist alongside him. And he said a lot of veterans comment to him like, oh, now you can sort of understand better than maybe the average civilian. And they're like, this is something that we face every time when we go to war. So that was the name of it, was War. I don't know if it ever was a movie or documentary, but he spoke openly about his experience with PTSD and seeing his friend die in front of him and how it wasn't unique. And so he kind of used that to to interview veterans and help veterans tell their story. So that's the only book I've read. And so I feel guilty. So I'm going to mention those 3 to the students and yeah, read one of these off the list. Maybe the one with the movie, so I can read the book then watch the movie. I'm doing that. You did mention, speaking of movies and YouTube, you mentioned a few, the healing process is important, and then a poem about being Black in the military.
Yes. The healing process is extremely important. I love this YouTube video because there's nothing better than a sane mind. And learning as a clinician, learning that I am human too, and I have feelings too, and I need to take care of me too. It's so crucial. It's so crucial. A lot of times I feel like clinicians, we just forget about ourselves and focus on the patients. I used to have my soldiers literally close my door in the clinic and sit me down. They would bring me lunch like, ma'am, no, you need to eat. I would have migraines because I was just so focused on, my passion was just there, but healing is so important, because if you're not good for yourself, you're not going to be good for anybody else, for your patients. The poem about being Black in the military is very special, especially with everything going on right now with Black Lives Matter. It just really shows just the struggles of just facing stigmas and stereotypes. I'm sure many of you have even heard of the new change in regulations that has helped a lot of Black soldiers in terms of being able to wear our hair in braids or locks and things like that. So, yeah.
They're also getting rid of VA photos on your ward using AR.
Oh, really?
Mm-hmm.
Oh, wow.
So that they won't know basically what you look like to verify, to figure out if they want to promote you or not.
Like promotions, that's awesome.
Mm-hmm.
I agree with that.
That's better for promotions now.
Mm-hmm.
Even with names, sometimes for those of us who have very ethnic or very traditional family names, I think that's important too. When they've done tests with resumes, putting, a traditionally Euro, Anglo-Saxon type name compared to very ethnic names, from whether, Latina or Asian or Black, they've seen that people get hired more when using the fake name. I think they did one man, they changed Jose or like Juan to like Joe or Joe. And
because my name is very Jamaican.
Yes, pizza.
Yes. So that'd be interesting that they're moving photos. I wonder if they'd be, I don't know how you get around that. And so that's something I talk about often with my spouse is you can't really get around it. Whether it's your name or whether it's your photo, so that's interesting that's something that they're considering. So thank you for bringing up BLM and also your experience being, like you said, Black, a woman in short in the military. You did mention several websites, just to conclude here and let everyone go. Thank you for your time. So you did mention several websites. So were there any of these that you wanted to pull out? I think a lot of them were mental health and PA resources, as well as veterans resources. Were there any ones that you want to tell the students to call their attention to as future clinicians, maybe that they should use or review?
I definitely recommend the PA Life. It talks about mentorship and also understanding the veteran experience. I believe that one actually has recordings where you can listen to that's actually talking about their experiences and coping mechanisms.
Okay.
That's really good. Thank you so much. I think there were a few others. Rebuilding warrior stress.
Via Hope, that prior slide.
Okay, Via Hope. Okay.
Yeah, Via Hope. That's the program that I will be doing my training through to become a peer support counselor. So that's why I added that. It's a very good program.
Awesome. I saw the online certificate too for military veterans health policy and advocacy. I was like, oh, maybe Professor Toussaint needs to get this into her, resume, so that when I'm, talking about veterans issues and things like that, and considering how I can be more involved and include them in my advocacy work. Because a lot of times in different policy advocacy spaces, I don't know that we mention veterans a lot and how it's such a unique population. You all have your own unique needs. And so even as we're going forward talking about, like you said, mental health or suicide, or even if it's diabetes or any other public health issue, even I think tobacco use and things like that, substance use disorders, we don't talk a lot about this unique population. So we talk about, race, ethnicity, gender, things like that. But I've come across very few studies really that highlight the need among this demographic. We hear a lot about the mental health, but I don't know about co-occurring with substance use disorders. So I definitely think it's really important to be, trained in that area if you're going to be talking about it, and even partnering with people to do research. So I got approached about that, and I was like, I don't really know about that. Like you said, just kind of getting thrown in there, and I'm like, I don't know about that. And so definitely something that's interesting. So thank you for sharing that resource so future clinicians themselves can utilize that also.
You're welcome. Substance abuse, I forgot to mention, is another public health major issue affecting veterans. Yeah, major. I've met a lot of veterans dealing with that, and even peer support counselors who counseled me in my groups used to be on drugs. They recovered, became peer support counselors. They're veterans, and now they're helping others. So it's amazing. It's amazing.
Awesome. And this PTSD assistance card, what was that? Do you recommend that for future clinicians? What was that?
Yes, that basically is just showing a card that someone with PTSD, well, so not necessarily, but it's a card that shows somebody who has PTSD, they can carry it, and if something happens to them, it'll show them like, okay, these are my symptoms. Because with PTSD, you have paranoia, hypervigilance, insomnia, anxiety, so.
Oh, thank you, Avita. One of my students that's engaged in policy advocacy work at her internship just said, thank you so much for the insight. Awesome. I don't know if you can see the chat box, Ramona.
Oh, you're welcome. Yes.
Yeah. You said sometimes you forget to take care of it. Yeah. So thanks for hearing the resources. Oh, thank you so much, Avita. That's very kind of you. Yes, it's such an important thing to remember, self-care and not burning out, so y'all are already doing so much work. I mean, I tell the students in the public health science program all the time, they are rock stars. I probably couldn't compete with them if this was 15 years ago when I was an undergrad. And so they're just doing incredible work. So yes, I do thank you for sharing about mental health and self-care, because they definitely need to hear it from somebody other than their professors and advisors in the program, that they're doing enough, and that, like, when is enough? So thank you so much, Avita. I think that was the last of the resources. Are there a few more websites? Yep, so that would be all. I will stop recording. Any final remarks, Ramona, before I stop the recording?
Thank you for having me today to speak to everyone. I've spoken to smaller groups at the VAs, but this is definitely a larger platform where I am being open and honest about my journey, and I appreciate everyone for your support.
Thank you. Glad to have you.